Hi everyone, I did my disability on Fragile X. I'm just going to give you a breakdown of the important areas that I found that were important. What is Fragile X? It is a genetic condition that affects more males than females. It is on the X-linked disorder, meaning that it is located on the X chromosome. It can be passed from father to daughter or from mother to daughter or son. The gene that causes Fragile X is the FMR1 gene located on the X chromosome. The defining features and characteristics. Fragile X can be portrayed in three ways, including behavioral features, physical features, and developmental features. Behavioral may include poor eye contact, anxiety, undesirable response to touch. Physical may include long, narrow face, large forehead, flat feet, sunken chest. And developmental may include developmental delays, intellectual disability, fine/gross motor delay, language and cognitive delay, and struggle with coordination. Expresses through birth to 5 across developmental areas. Social emotional, most young children, especially boys, have social anxiety such as meeting new people, being in new places, and doing new things. For physical, infants and young children do not have any distinguishable physical features. They have a soft, silky skin, broad forehead, and bigger head than other children their age. Language and literacy. Individuals with Fragile X usually say their first words at 2 years old and a short sentence at 3 years old. Some individuals don't even develop speech. For sensory areas, most boys are easily upset over sight and sound. Infants and young children are sensitive to certain sensations, such as textures on clothes. For the services provided are therapy, education, and medication. Therapy, speech and language therapists, occupational therapists, behavioral therapists, and physical therapists. Education, IDEA makes it possible for most individuals with Fragile X a guarantee for a free and appropriate education. If they do not qualify for special education, the team will design an individual education plan. If they do. Educational implications, having structured routines and transitions in the classroom. Reduce sensory stimulations. Individuals can be included in the classroom by having him or her write their letters on an iPad, just so, on an iPad it might be easier for them, while others are writing it out, tracing, or turtle writing with an assistance from the teacher. On medication, there is no specific medicine that can cure Fragile X syndrome. Doctors may prescribe medicine for the symptoms, but only on a trial basis or in a dose that works for the individual. So like example would be Prozac for anxiety. Parent and cultural resources. I found that the Natural Fragile X Foundation, and I included the address and the number and the website just so to give more parents information if, maybe they don't have the internet, they can maybe call them or maybe they can send them a letter. University of Minnesota does have a Fragile X clinic. And I also did the address and the website. Our Fragile X World. And then I also found an article on mothers in the context of Fragile syndrome, implications for caregiving work and romantic partnerships and relationships. And I also found another journal article on raising Fragile, the experience and perspective of families of male Fragile X individuals. And the more of the information I found was it affects more males than it does with females. And just a couple facts about it is Fragile X syndrome is one of the most common genetic causes of intellectual disability. Fragile X affects 1 in 4,000 males and 1 in 8,000 females. So what I just talked about before, it affects more males than females. And Fragile X can be detected through a blood test. Thank you.